Okay, this morning we're going to be talking about plantar flexion and promoting that type of mobility for someone's talocrural joint. It occurs in the sagittal plane, and the muscles that perform it are your gastrocnemius and soleus are your two major ones, and your accessory muscles that also assist in that are your tibialis posterior and your peroneals, so your peroneus longus and your peroneus brevis. So to see how much mobility my patient has in plantar flexion, I'm going to have them lying supine, or they can long sit if that's more comfortable for them. I'm going to have their foot hanging off of the table, and please get back just a hair. Typically you want to stabilize the joint just to make sure that they're not having any accessory movement. And I'm going to stabilize at the distal tib-fib joint closer to the talocrural joint. And then I'm just going to slowly put their foot into plantar flexion to see what they have. We're not holding it for any amount of time. We're just going to see what they have as far as the joint motion. So if I want to promote more plantar flexion, I need to focus on the talocrural joint and what it's doing first. So that type of joint is a convex concave movement. So it's going to be the opposite direction that it's moving. So if she's going into more plantar flexion, the joint will roll into this direction and it's going to slide in the anterior direction. So if I'm going to try and promote more plantar flexion, I want to move in this direction down towards the table. I've had my patient roll into PROM, so that's a little bit more easier for me. If it's uncomfortable for the patient, there's an alternate way that we can do it as well. So for this, you want to make sure that you're stabilizing at the talocrural joint. So you're going to be just proximal to it on the ankle here. And I'm going to be pushing into the table down in this direction. The joint isn't straight down, it's more of in a diagonal direction. So make sure that you're providing that mobilization in that direction as well. So if you want to, you can provide stabilization under the joint here, or you can use the table, whatever's more comfortable. And then I'm going to put the web space of my hand right on the talus, and we're going to just provide that mobilization in the anterior direction this way. If I wanted to promote more joint mobility, you can do a grade 3 or 4 oscillation, or you could do a sustained hold, which is what I'm doing. Typically for the sustained hold, you'll hold it for 30 seconds, and you'll do this 2 to 3 times, depending on how much plantar flexion you gain after performing each mobilization. So now we're going to go into some stretching techniques. I'm going to do it myself on my patient, and then I'm going to teach my patient how to do it at home. So sometimes if someone is limited in plantar flexion, it's because they have tight dorsiflexors. So we're going to work on stretching those first. So I'm going to provide that stretch initially. So to make sure that she's not having an accessory movement at the knee, I'm going to stabilize the distal tib-fib joint, and I'm going to make sure that we're getting that all the way down to the toes here. Muscles that might be limiting plantar flexion are your dorsiflexors. So those muscles include your tibialis anterior, your extensor hallucis longus, your extensor digitorum longus, and then your peroneus tertius. So when you're stretching, you want to make sure you're getting all the way down to the toes, and we're going to put this foot into this stretch. Typically you want to hold 10 to 30 seconds, and I'm not going to hold it that long, but you'll do this 2 to 3 times a week is the recommendation. If you can do it daily is even better, and you're just going to put them into the stretch till they feel a slight tightness or a little bit of discomfort but no pain. And we're going to try and do that more often than not. Now I'm going to teach her how to do it herself, so if you can sit up for me. So I'm going to teach my patient how to stretch her dorsiflexors to then help with plantar flexion. So if you can, cross that ankle over your knee for me. And what we're going to do is we're going to just hold our hand and relax our foot here, and then use this hand to pull our foot down into plantar flexion. Like I had said earlier, there's several different muscles that act on the dorsiflexion movement, so we want to make sure we're putting our foot into different positions into plantar flexion to make sure that we're getting each muscle in the appropriate spot. So for example, your tibialis anterior does dorsiflexion and inversion. So to stretch that muscle to get more plantar flexion, we're going to put it into plantar flexion and eversion, which is down and out. If you want to just stretch your extensor digitorum, making sure that we're getting all the way down to the toes, and then the other muscles as well. So just making sure we're going through different sections of plantar flexion to get all of those muscles that are affecting your potentially tight dorsiflexors. So now I'm going to show my patient how to work on a resistance exercise to promote increased plantar flexion strength. So for her, I'm going to use a blue band to start, which is a relatively light resistance just to see what she can tolerate. We're going to put this on the ball of the foot. And then I'm going to have her hold on to the ends here. And we're going to kind of cue in a motion like pumping the gas pedal. So we're going to go nice and slow and pointing our toes, and then slowly bringing it back up. Good. So for this resistance exercise, I would have her do 8 to 12 reps for 2 to 4 sets with about 2 to 3 minute rest in between, and 2 to 3 times a week, making sure that this band is consistently tight and pulling that foot into dorsiflexion initially so that there's resistance, and then pumping that gas pedal nice and slow and controlled.